Well, thank you very much for joining us today. It's our second annual National Construction Day. And again, thanks to our sponsors, Travelers Canada and Northbridge Insurance. I'm Mary Van Buren, President of the Canadian Construction Association, and it's my pleasure to moderate this very important discussion today. Ask that if you have any questions to please use the Q&A feature as opposed to the chat, and we'll save some time at the end to answer your questions. As it is National Construction Day, please use hashtag Construction for Canadians and help us celebrate this important day. So we're entering into the second wave of the pandemic, and it's critical that we maintain the very high standards that were established during the first wave. And industry and associations collaborated generously and quickly to ensure that families, workers, and communities were safe. And we proved that we could do so. And the second wave is now bringing new challenges. We've got more services that are open. Children are back at school, for example. And so there's greater risk of exposure for all of us. So it's more important than ever to make sure that these health protocols are in place and respected, because we all want to continue to remain open. So joining me today are three leaders in the industry to share their perspectives on COVID-19 and also some opportunities and challenges as we look to 2021. So we have Alain Lahaye, who is the Chef de Service de Prévention des Lésions Professionnelles, and Alain is with the Association de la Construction du Québec. Alain has over 15 years of experience in construction and has been working in the field of safety, environment, and occupational hygiene for 30 years. Also joining us is Robert Love, and Robert is the Director of Project Services with Alberici Constructors, and he has over 15 years experience ensuring a safe and healthy working environment in all of Alberici's market sectors. And we also have Ron Spirinello, who is the President and CEO of Gisborne Industrial Construction. Ron has worked in the industry for over 30 years. He's a mechanical engineer, he has an MBA, and he's also Gold Seal certified. So welcome to all of you. So Robert, let's start off with you. So we know that the industry has had a long history of safety. So what were some of your priorities before COVID-19? And then how did you adapt to that as we went through the pandemic?
Thanks, Mary. And, I'll start by saying hello to everybody and thank you for having me on today. I really appreciate the opportunity to speak here, and to the other panelists, of course, welcome. That's a great question. And interestingly enough, what we were focusing on before COVID was trying to find creative ways to bring people together, ironically enough. It was all about communication and sharing of best practices between project sites. One thing that we see is, as I'm sure a lot of firms deal with, is the idea of these silos. We get into our project silos, and what happens is we don't talk to each other. We don't share what's working. We don't share what we can improve on. We don't, we tend to lose focus of trying to find the better way to do things. So, before the pandemic, our priority was on building trust, coming up with good conflict resolution processes. Whether or not you're what trade you work for or what subcontract you work for, recognizing that we are all working towards a common goal, and that these win-win scenarios are possible, provided that we all are being transparent with each other and openly communicating and sharing what's working. So that was our focus, and I'm sure we'll carry this conversation forward to during the pandemic and post. But a lot of the same principles sort of apply, which is a common theme that I'm going to share today is open communication and transparency throughout this process.
So that was quite the about face then, with COVID-19 hitting. If you were focusing on more face-to-face communications, and then of course entering physical distancing. So what's one thing you had to adapt given your emphasis on communications?
Oh, no, not different for us, and I'm sure it is for everybody. It's finding creative ways to connect, right? And that's really at the end of the day what's most important is, the information is out there, and we just need to find a way to bring people together. So, like a lot of firms, it's exactly what we're doing here today. It's virtual meetings and virtual teleconferences. It's setting up different teams or subcommittees that can bring information forward to the overall management team. So really, it's just about embracing our creativity.
All right, thank you, Robert. So Ron, the next question is going to be for you. So we've made it through the first wave. We're in the middle of the second wave. What are some of the lessons that you learned in the first wave that you are taking forward as we manage through this next pandemic?
Mary, thank you for inviting me here today. I appreciate this. So some of the lessons learned that we've learned in the first wave is that this is a very dynamic situation, and the communications and recommendations from the government have changed a few times as they've learned more about it. We are making sure that we reevaluate our plans as required and make sure we communicate our plans and our expectations along with responsibilities, requirements, and procedures to our workforce. Also, we're ensuring that we have a sufficient supply of COVID-related PPE and cleaning supplies on hand. Not that we're hoarding, just a sufficient supply. And lastly, the other lesson learned we're carrying forward is there was a lot of fear at the front end of this, a lot of stress and anxiety. So we're making sure we monitor that and help our workers deal with that. Maybe take something off their plate so they have less stress to deal with on other aspects. And we have internal assistance for them and through our benefit provider if required. Complacency, though, is a concern on all aspects of health and safety. Large part of the successfully implemented health and safety program is overcoming complacency and risk tolerance issues within the workforce. In my career, the construction industry has done an impressive job of implementing new processes and procedures, more robust use of PPE, the tools and techniques that were used to implement those changes, and guard against complacency on those issues we are using to guard against complacency on our policies and procedures and tools we're using to manage our response to the COVID committee. Those are senior management leadership, where if possible, we've had great success with senior management going to our work sites and conveying our gratitude to the workers for showing up to work. I mean, let's remember, it was pretty a scary situation at the front end, and the workers, they came into work and they appreciated senior management conveying their gratitude, setting up a COVID committee and setting up policies and procedures to deal with COVID, and then making sure we were communicating those, reinforcing what we were doing through audits, inspections, catching people doing things right, doing it right in the field, and if required, discipline for non-compliance. Having a sufficient PPE, COVID-related PPE and cleaning supplies on site, and doing the daily cleaning or the more robust cleaning, that's a visual cue for all the workers on the job site to see, to remind them that there's other responsibilities and things for them to be doing to manage our COVID response. At Gisborne, we tend to start our internal meetings with something called the safety share. It's not unique to Gisborne. We've rebranded that as a health and safety share. So it's kind of a cue for people to bring up. Before, they were always bringing up safety related items. Now they're bringing up COVID health related items, mental health related items. So it keeps it front and center. And then making sure we're following all parts of our HSE program and procedure, like safe work practices and policies and procedures that have been amended to deal with COVID. Make sure we're following all those. So there you go, Mary.
Yeah, no, that's great. So a couple of themes I think you built on from what Robert said in terms of building trust And sounds like one of the ways you've been able to build trust is by having management on site with workers. The commitment to the more robust cleaning, the commitment to PPE, the commitment to reinforcing it. Sounds like that's earned the trust of employees and workers, as you said, who were nervous during the first few days of the first, I guess, few weeks of the pandemic, for sure.
Yes, very good synopsis. Thanks, Mary.
All right. Alain, you're up next. So we've collaborated as an industry, and certainly one of the tools that CCA was able to provide were the health and safety protocols, which were built with our industry partners and associations. And recognizing that there are regional differences, what are some of the tools and services that SAQ has been able to provide to members in Quebec?
First of all, thank you, Mary, to invite me. And good afternoon to everyone again. So in fact, many tools have been done since the beginning of the pandemic. We work on different kind of register checklists, and mostly one of proud is that we put online a ACQ guide, or I should say a QCA, but based on the certain facts that the CNSST, this is our Health and Safety Commission, they put at the beginning of the pandemic when we returned to work, because it was kind of different between the provinces. Quebec, we have to stop mostly a month, completely a month of not working and then the construction site. And the CNSST guide was there to help us to get over and to restart the work site. So what we were doing with those information that was coming from our public authority, like I mentioned about the CNSST Commission, and also with the public health that I think everyone has in their province. And for example, for two example, one of them, it was a register for healthy condition when a worker wants to get in the working site. So I think everybody's got to know that register. It's everywhere in Canada. So this is a kind of register that we focus on that, because you must be for the worker or every employees that goes in the work site or everywhere, not even construction. You must be in good healthy condition to work on the work site. So you got no symptoms. I think this is an efficiency barrier to prevent workers coming working with symptoms. If a worker is sick, he has some significant symptoms, is going to be stopped at the entrance. The register is there. You have to complete and file it correctly. And I think the equation is very simple with that. It's if there's no sick people on the work site, equal to no biological contaminant on the work site, equal no contagion or contamination. The second tool that we are proud of it's the ACQ guide. So I was mentioned before, it that's for sure on the scientific facts and literature about the biological virus and the spread, the control of the virus or even the disease of COVID-19. Those information that's like I was mentioning, coming from our public authority. So we are simply add a few tips, advices, clarify some procedure or protocol, and telling at the contractor the standard application of a general hygiene condition on the work site, like our two colleagues mentioned before. This is the basic of those hygiene condition to be to stop the progression of the COVID-19.
And by all reports, the industry was very successful in minimizing or eliminating any contamination on construction sites. So again, something to be very proud of for that record, and a reason to not let our guard down and keep those standards high. So Robert, we talked about safety culture, you talked about the communications. What else have you been doing to strengthen this culture? Ron spoke a bit about, renaming it from the safety briefings to the health and safety. So maybe some examples of what Alberici's been doing.
Yeah, sure. Actually, Ron, you said a couple things that I want to come back to, which I thought was really well said, which was, conveying gratitude, positive reinforcement, and recognizing anxiety. I think those are really important, folks. And it's important that we as leaders and we as managers recognize that there are different levels of anxiety out there, right? And people are approaching this very, very differently. And who are we to tell them what is right and what is wrong as far as how to feel? Everyone is in a very different situation, whether it be personally or professionally. And so keeping a focus on the human element has really helped us. And I think it's a really important message for everyone to take away here. Coming back to that concept of over communicating, we found success in leaning very heavily on our health and safety representatives and our joint health and safety committees. Remember that these men and women are your pipeline to the workforce in a lot of cases, and they can be a really strong voice for you, and they can be a really great support for you from a project standpoint. So leaning on those support mechanisms, I think, has been really successful for us and is really important. And the other thing is to make sure that you come up with a system to get information out quickly and effectively. One other thing that Ron pointed out is that it's a very dynamic situation and things are changing very rapidly. So as a leadership team, as a management team, make sure that you establish your system, whatever that may be, to get information out to the people that need to receive it in a way that or in a medium that they can receive it effectively. And then lastly, working collaboratively with all of the industry partners out there. Mary, it's something that you touched on. There's a lot of really good information out there, and there's a lot of really good, smart people out there. And Alain touched on a couple tools that have been made available and a couple registers that are available. So designate a champion in your organization to be that person to receive or to receive all those inputs, all that information. And then again, following that chain of command or communication structure to get it in and then get it out. So those are a few things that we've done to really continue to push a culture. At the end of the day, folks, we're really strong believers that strong performance is really a result of strong safety culture. So that if you continue to focus on building your culture, and if you continue to focus on the people, you're going to get strong performance as an offshoot of that.
Just building a little bit on that and what Alain had said about the tools, how have you been able to help some of the smaller subcontractors you might work with who may not be as well equipped as say a large firm as yourselves would be? Any tips on that?
The word we like to use is that safety is not proprietary, and we really believe that. That we are happy to share any information that we have and any programs that we put together. It's really committing to recognizing that we are one team and that we have one voice on a project site. It's breaking down those barriers of individual risk and recognizing that that there is shared success, there is mutual benefit, right? If one of our subcontract partners has a worker who becomes ill, it affects not just the individual, but affects the entire project, right? It's not just going to stay within one group. So, I think anything you can do to share the information and work on the collective success is a good one. A good example, we built hygiene stations or wash stations on site. Those aren't specific or unique to our self-performed trades, but they're available for everybody on site, right? If we're going to come up, if we as an industry find a supplier that has PPE available, which we know is sometimes in short supply, it's about sharing that information with your subcontract partners so that everyone has an opportunity to get their hands on what they need to keep their workers safe. Did I answer your question there, Mary? I'm not sure.
Yeah,
I go off on a tangent sometimes, and you gotta really rein me back in if I start rambling.
No, that's the point of having a discussion, that we get to add on new ideas that maybe we didn't think about touching on before as we go through the conversation. So no, that's great. Ron, we've been talking about anxiety, mental health concerns, and in fact, there was a recent survey by Léger and Associates that said that 25% of Canadians have said that their mental health is worse than it was during the first wave. So anxiety, burnout, very real. People juggling their children either at home or trying to get them to school, maybe elderly parents who may be sick, and just, careers as well. So maybe talk a little bit more about, you had mentioned earlier about your firm has been monitoring it. What are some things you're doing? How are you monitoring it? And what programs are you finding is helping? And what else might you consider?
Okay, thank you, Mary. Mental health, it's very important to me personally, and as a leader in my company, I think I do a pretty good job conveying what's important to me becomes important to other people. Society in the last handful of years has done a way better job at communicating the importance of mental health, which has made it easier for people to discuss it and to ask for help. We as a society when we deal with mental health issues, we have improved our compassion and empathy. We need to work on, myself included, our patience when we deal with the situations and people with mental health issues. When we deal with people who have health issues, they usually have a scar or a limp to remind us of the situation we're dealing with. Mental health does not tend to have those visual signs. So in our company and in my life in general, I'm working on my patience on this. For our workers on our job site, I'm going to break this into two parts because we have workers on our job sites and then we have our office workers. The vast majority of our office workers are teleworking or working from home. So our workers on our job site, like I mentioned earlier, had a higher anxiety level at the beginning of this pandemic. And by us as senior management conveying our gratitude, going visit them, at the place where they were afraid to be, that did a lot to ease their anxiety. Getting the proper PPE and cleaning in place really went a long way to alleviate that anxiety. For our office staff, like I mentioned, the vast majority of them are working remotely, or we're calling it teleworking. I'm not sure of the proper terminology on that. There has been concerns for mental health for the reasons you listed, Mary, and another one is the lack of human interaction we've seen play on people's mental health. So we've implemented one of the things we did when we're on a job site and we have a worker working in a remote area by themselves. We have a process and procedure where their supervisor has to check in with them 4 times a day. So we've implemented that for our office remote workers with their supervisors, forces more conversations. We forcing them to have their cameras on because you can pick up visual cues better from the person when you're communicating with them. And by having these more conversations, we get a better idea if people need help, and then we have the supervisors work with myself, our HR department, or whoever to get that person help either on stress relieving techniques, removing some scope from them seems to help sometimes. Benefit provider, internal people that can help them inside our company. We've been having social events online with the cameras on, such as a Halloween costume contest. I didn't win. I came as Ron Spirinello. And the peer-to-peer communication is important, and creating an environment where people feel that they can ask for help for themselves or ask for help for one of their workers or their peers is important. And a simple thing we did for the people working from home or teleworking is made our work schedule more flexible, meaning if they have to deal with their kids, and they might work a little later in the day or a little earlier in the day. So, and again, rebranding our safety share to a health and safety share helps bring up these items in our daily meetings, at the beginning of our daily meetings. So did that answer your question to any degree, Mary?
Yeah, absolutely. And I really take your point about the patience and empathy. As you said, we have a lot more experience dealing with other sorts of issues. And that's something that, as you said, with mental health, it's not always obvious. And so to be more hyper aware of that. Robert, you wanted to chime in?
Yeah, no, Ron, again, you triggered something for me there, man. And it was back when you were talking about, leaders leading, right, or walking the walk. And one thing that we often see is it's really easy to put fancy words on paper, right? You can take guidelines that are online and you can create a company policy and say, here's my policy. But, I think one thing this pandemic is really testing is our ability to actually do what we said we were going to do. And so I like what you said there, Ron, about, managers coming out and walking the project sites and seeing that, hey, this is what we said we were going to do. Are we actually doing it? And engaging with your workers and soliciting input from them to figure out what's working and what's not. So, one reminder for the group here is take a look at your policies and make sure that what you're committing to is actually what you're doing, because it's not a one size fits all thing. We can't all implement or execute the exact same programs. So make sure that what you are rolling out is effective for the size and scale of your organization.
Excellent. Alain, on the same theme, what are you hearing from your members about issues with mental health, and what are some things that we could do to better help the members?
Well, for mental health is quite an issue for everybody, and I think with all the work and the schedule and that part of the world that's going on, they have to be in a good shape. So they have to be focused and close to their employees to perform. That's for sure. But be aware that sometimes you won't respect the delay because of missing some material, missing some things that you can handle it. So they try, sometimes we can see they try to control everything. So just make a step before to see what you can do more with what we got presently. One thing of that is for sure that we're going to grow with that, and we hope that they won't have a third wave of this pandemic, because we're getting more and more kind of fatigue, and the hours are very stressful. So I think if we think we have to say something, it's that taking that thing on the positive way to grow up.
Yeah, absolutely. Hearing the same message around the fatigue, and that's why we worry about complacency setting in the safety standards. And glad to hear, the message reinforced that absolutely firms are taking it extremely seriously and switching it up and trying to keep it fresh every day. And the just even the challenges of Zoom fatigue, people are calling it. I mean, Zoom's a whole new word now that didn't even exist. I mean, it used to just belong to Mazda MPV, but now we go on Zoomies and we're getting Zoom fatigue, and it's a whole new language that's sparked around it. And so yeah, how do we combat that social isolation in the best way we can? And Ron, I'm sorry you didn't win the Halloween costume, but generally there's seasonal holiday parties coming up, and often there's an ugly sweater contest. So maybe there's hope for you yet. Robert, did you want to say something? I noticed you.
Oh, no, sorry.
No, that's all right. It's all good.
Just preparing to jump in,
Yeah, exactly. So CCA has produced a seminar back in June called Navigating COVID-19, and it features Dr. Ash Bender on mental health and construction during recovery. So again, invite you to take a look at some CCA's resources. So let's talk about productivity. Strong emphasis on the robust cleaning, the questionnaires before coming on site. We know about the physical distancing, one or two people to a truck, for example, or one person in the elevator going up. So what are you seeing in terms of productivity challenges, and what have been some solutions? Is technology helping you out or no? And maybe Robert, we'll start with you.
Sure. And yeah, absolutely. There's an impact to productivity. I think we're all feeling that. That's no surprise there. So a couple things that technology-wise that have been effective for us. We coming up with streamlined ways to screen employees before they come on site. We are taking advantage of both an online tool as well as a paper form, but using QR codes that the workers can scan daily at home on any device. Doesn't need to be a work phone. That allows them to complete the questionnaire or the screening tool before they leave the house. It's a pretty simple and available technology, and a relatively inexpensive one that's proven to be effective for us. Looking at rotating shifts, right? So trying to create sort of red team, blue team type ideas where you can minimize the total number of bodies on site, I should say distribute the number of bodies on site while maintaining productivity has been one thing that's been effective for us. And similarly for management, creating redundancy. So making sure that we have two people capable to perform each task, so that if one person is required to self-isolate for whatever reason, there's someone else that can seamlessly step in and pick up the ball, so that there's not a lot of downtime there trying to get brought up to speed. So I didn't really speak too much to technology, to be honest with you, but certainly some tools that we've used to help battle that productivity crunch.
Are you looking at any tools going forward?
Well, we have obviously inquired about various, self-test or different testing mechanisms to try and streamline that or to get ready access to that. Admittedly, we haven't been successful or found one that's going to be practical and cost effective for us. From an RFID standpoint, there's certainly a lot of companies out there that are starting to push simple trackers that sort of monitor separation distance. And so we are looking into some of that. Admittedly, though, we haven't jumped at any of those tools quite yet.
As you know, the industry is seen to be lagging somewhat in innovation and R&D compared to other industries and certainly other countries. And so with COVID-19, we've seen certainly other sectors such as retail really have a quantum leap in adopting new technology and innovation, for survival reasons. So we're expecting to see the same in construction, that there will certainly be a big jump in adopting new technology, even in things like, and maybe Ron can speak to this, so many people working from home who didn't used to be, the whole idea of having, connected into different kind of software, BIM, et cetera, is becoming a higher interest. So Ron, over to you. Any comments about productivity and how you're looking at new ways of doing things or technology?
Yes, productivity on sites has been affected by COVID and the response to COVID. I'm pleasantly surprised how the office work, the estimating, the engineering, how well that is working remotely or teleworking using like Teams and Zoom and BIM. All those things are working way better than I thought they would. So we formed a committee at the tail end of this pandemic. We're going to have to figure out what model for our office staff we're going to have in place. Luckily, I don't have to make that decision, or unluckily, I guess I don't have to make that decision just yet, but it's opened up our eyes to how we can use our real estate, our bricks and mortar maybe more efficiently to drive more value. So we're putting effort into that. And one simple thing on high-rise construction, we've changed our start time and our work schedule to minimize how many times our workers have to get on the skip in a day. Some simple little things like that has gone a decent ways to mitigate the risks. Spreading out our workers on a alternate shift, that helps with the direct cost, but it kills my indirect costs. So pick your poison, I guess, but then I guess we are able to maintain schedule by doing that, and that's a critical success factor for us, or a KPI. We haven't been able to find any unique technology. We haven't given up, but that we can implement right away. To add on to what Robert was saying.
If there's people on the call, I'm not sure, Mary, if the chat function's open right now, but if any of the professionals on the call right now have ideas or have seen something successful, share it with the group.
Great suggestion. Yes, we will certainly be taking any questions and just post them in the Q&A function so that we can answer any questions that you may have. And yes, please share any tips or tricks that you have as our speakers are talking about what they're doing. Alain, over to you. Anything in terms of what you're seeing that your members are using technology or innovation to help with productivity? Oh, you'll have to unmute.
The classic unmute, huh?
Yeah. Making no echo after all. So for us, that's for sure. There's a kind of difference between all the firm that you mentioned. At ACQ, we have mostly like 2,800 member in the mutual, and we have also 17,000 people a firm, and ICE that we call an institutional, commercial, and industrial. And 80% of those firms are maybe like 5 employees and less. So before talking about technology, high-level technology, what we had to suggest before, well, at the beginning of the pandemic, to respect, to work and the 2-meter distanciation, it's to planning, to plan or to organize the scope of work. instead to score the big goal with high technology. We know that it exists, but they are a small group, they are small, so they don't have that kind of fees or that kind of money to get the technology. And like an example, they have some workers that were working and there were 3 of them. They were working in the 2-meter distanciation. So instead to have all kind of technology, they should like planning something to uh, make a kind of support or stand to make the point over with that guy will be alone to fix the equipment. So that's pretty easy. It's pretty simple to say, but sometimes it's pretty hard to make that way. But you have to think it before to work to respect the 2 meter of distanciation. This is the key sense for us. So what we're explaining to the contractor. Also, the other, it's not a technology, but to resume before what we have said, um, our main goal is to have the same response to everyone. So on the website, we put all the protocol, all the procedure that when we're talking to contractor, to talking to the 23 health and safety advisor that are with the group of the health and safety department. Um, we have to say all the time the same reference, the same thing. So this is not quite new, but it exists with those websites. So we should learn with that when you got some reference, you got something to make edit writing down. So you have a central point that everything is at the same place.
Kind of like a wiki for construction health and safety. That's a great idea. So still on the safety theme, workforce shortage is an issue that keeps coming up, despite the pandemic, or maybe with no thanks to the pandemic. And one of the concerns that has been raised among some groups in terms of a career in construction is their perception that it's not safe or not safe enough. What are your messages to parents and to people considering a career in construction around our safety and safety track record? Robert, do you want to start?
Yeah, sure. Well, yeah, I will start. Yeah, thanks. And you're right. It is a problem, and I think you hit it on the head there. I think a lot of it does start with the stigma, which we as an industry are trying to overcome. Regarding safety, I'm personally, I'm really proud of the commitment the industry has made to safety excellence, and representing the ICI sector, I'm even more proud that we have some of the lowest incident rates out there, and so I think we are seeing a shift. We are having success as far as messaging. That safety is a priority. Safety is first, and people, coming back to that term, people are walking the walk. I'm still relatively young in my career, but even in the last 15 years, I think we've seen a huge shift in how effectively organizations are fully integrating safety into everything that we do, and so that's really, really positive. And I think as an organization, we have to continue to target those organizations, those bad actors out there, and target the underground economy and those companies that are putting the lives of men and women at risk, and holding them accountable. It's great that we're starting to see safety built into more core curriculums at younger ages. I think the various industry associations across the country are doing a better job getting into schools, both at the high school level as well as at the collegiate level, to try and talk about the construction industry and trying to overcome that stigma and carry that message forward about the importance of health and safety, because it's an extremely rewarding career, and it every day it is becoming more and more safe. And I think the statistics, if we share them with everyone, we can demonstrate, or we can back up that talk that we are a very, very safe industry. So yeah, I think we're taking positive strides. I think we need to keep the pedal down, and we need to keep pushing that message that this is a rewarding career path, and it is a safe career path.
Yeah, and perception often lags quite a few years. So, what people of, raised in a certain generation would view it, from the time that they were raised, as opposed to how it is really actually happening today. Ron, you've been in the industry for 30 years, so you've seen even more changes than Robert. So comments around, messages you would, you tell people, as I'm sure you do when you go to parties and people ask you about it. So what do you tell people about safety in construction?
Well, for us recruiting skilled workers and workers into our industry, it's been a while since people have mentioned a concern about safety in the industry for their kids or themselves. What I find is still out there is this ongoing stigma that going into the trades is somehow less than going to university or post-secondary education. We try to convey to them all the opportunities that exist going into construction. My COO, I went the university route, but my COO, he is a tradesperson. A lot of people in this industry, leaders in this industry, who do very well for themselves, have created a lot of opportunity for themselves. We are just always trying to communicate that as we are trying to recruit people. Luckily, it's been a while since anyone's mentioned safety or lack of safety as a barrier for them entering this industry or their children entering this industry. It is our number one priority. It has been for a long time, to add what Rob's saying. And if you track it and you make it your number one priority, you improve on it. So Mary, I don't think I answered your question.
No, well, that's good news to hear the other side of it, that that hasn't been the concern. It's more the trades. And just a factoid that you guys probably know as well is that the average age of somebody entering college for a trade or into a trade is 26. So often they've done a degree in university, or they've done a college degree, and now they're going back to enter into the trade. So going back at maybe an older age, but coming in nonetheless. So as you say, many paths to success, whether with or without university. Robert, you wanted to jump in there.
Yeah, a really short story here that relates to this. I have a family friend with a son who recently started in the trades. And in the first week on the job, he came up to me afterwards and he said, I had to refuse work 3 times. And you can look at that 2 ways. You can look at that, well, what's going on with that organization, and that's horrible. Or you can also look at it as a positive, as here's a young guy starting his career, and he recognizes the importance and feels empowered to stand up and say, hey, this isn't right, we got to fix it. So I'm choosing to look at it that way. But it comes back to, again, as within all of our organizations, how are we going to respond to those questions, right? We need to take the attitude that this is good, that people are bringing this up, that this is good that we're having these talks, and that people are empowered to challenge, right? To challenge the status quo. And if they see something that it doesn't look right or doesn't feel right, they feel confident enough to bring it up without fear of reprisal. So, I thought it was a scary situation, but you can look at it positively as a young fella starting his career, right?
Yeah, the BC Construction Association has a program, the Builder's Code. And in addition to that, they have some videos that go along with it about don't being a tool. And that's all about being open to the conversation, and that the culture about safety is being respectful and having those conversations. It's everybody's job to raise their concerns and to feel open and not embarrassed, to have that conversation. So Alain, did you want to speak to what's happening with Quebec, and how you guys are reinforcing that message in the recruitment?
Well, that's for sure. There's probably too much choice of career for the young people, but let's see that way. It's a main issue here in Quebec for qualifying, recruiting skilled worker, and at least we have figures that it's missing like 16,000 qualified worker. So it's a big issue, and something we can probably suggest to those contractor firm that there be some survey that you want. The other problem is to keep your good worker or your qualified worker. So one of the thing that the employer can do to keep those qualified worker is to show them that you're a kind of a firm or employer that believe and practice the health safety condition at work. So it could retain your skilled people and probably uh, give him a message that you're pulling with them to work safely in the organization.
Absolutely. Thank you for that. So we have about 8 minutes left. I don't see any questions in the Q&A. I'm keeping an eye on those. So I'll ask another question in the meantime. If you look at health and safety, and we've talked about the priorities of your respective organizations, what you've been trying to do, what is one thing, if you could, wave your magic wand and improve in terms of health and safety, what would it be?
Sorry, something different than what we're currently done, or sorry, help me out with that question a little bit more.
Yeah, so of all the things you're trying to do in terms of improving health and safety, what would be the one that would give you the most satisfaction that you've improved on?
I'm gonna come. Sorry, fellas, I don't mean to jump in there. You okay if I start? You're probably happy. You can take a little bit more time to think about your answers here. Yeah, I'm going to come full circle back to what we talked about or what I sort of started with, which is talking about that idea of trust. Trust is absolutely paramount. This industry, we're a unionized contractor. It's a relatively transient industry to begin with. There's a lot of stakeholders, both internal and external. That tend to have an a naturally antagonistic type relationship. And that can be destructive on site. It can be destructive to your culture. And particularly it can be destructive to your safety culture. And again, this happens between trades. It happens between management and craft. It happens between constructor and engineer, and constructor and owner, and all of that butting heads can really be destructive to what we're trying to accomplish and the culture we're trying to drive. So if I could wave my magic wand, it would be to have everyone recognizing that conflict doesn't need to be a bad word, right? The only difference between good and bad conflict is how it is handled. And so that if we all bring the attitude of transparency, mutual respect, and I know this might sound soft in some cases, but I think it's absolutely critical. Then that's what we are going to continue to push and continue to focus on.
Well, and that echoes what Ron had said too, in terms of it is a lot of the softer skills, whether that's the empathy, the patience, the leading by example.
Yeah.
We're not
And
talking.
they're not soft skills. They're not easy skills.
They're not
This is the
easy.
hard stuff, guys. This is the hard stuff.
Yeah. Ron, any comments from you?
Well, I'm going to say, yeah, I agree with Rob as the starting point. But at the end of this, if we can maintain the improved cleanliness and housekeeping on project sites, that will make me a happy person. A high percentage of Gisborne's safety incidences are slips, trips, and falls, which if we've done and do a better job of housekeeping, we will be getting rid of those risks. So I'm hoping we all continue better housekeeping and better hygiene, because the hygiene on the job site is a lot better now too, and I appreciate that. And I only make periodic visits to site. So if that can continue on the other side of this, I'd be happy with that aspect.
Yeah,
I agree 100%, Ron. We have a saying, a clean site is a safe site. That's a really, really good point, man. And, we challenge everybody here to try that.
Yeah, and the other benefit that we saw, back in SARS era, when again there was a very strong attention to cleanliness and sanitation, lower colds and flus, because again we're washing hands more and all that. So there could be another benefit, which is reducing common colds and those sorts of things, which should help everyone. Alain, any comments on the number one thing you'd be happy if we improved as an industry?
Well, maybe get back to the simple thing, and like they mentioned, those basic thing that we used to do it right, do it correctly, with a kind of a bonding to each other with the employers and the employees. Make sure that your message is clear, and the improvement will follow with those kind of advice.
Well, thank you, panelists. We don't have any questions. You've explained it very thoroughly. I've learned a lot from you today, and I really appreciate you taking the time. I know it's a busy time of year for you, and also want to thank so much to our sponsors again, Northbridge Insurance and Travelers Canada, for sponsoring Construction Day. And stay safe, everyone. Thank you for joining us.
Thank you.
Thanks,
Thank
guys.
you.
Bye.
Great.
Bye.